My name is Justin Dimick, and I'm from the University of Michigan in Michigan, USA. It's a large public university located in the middle of the United States, just below Canada. So my surgical field is called minimally invasive surgery, which is a specialty of abdominal surgery that focuses on using minimally invasive techniques, laparoscopy, etc. Clinically, it's bariatric surgery, so we do a lot of weight loss surgery and foregut surgery, anti-reflux surgery, and then a lot of other hernias, abdominal wall reconstruction for some reason, even though we don't do a lot of it laparoscopically, tends to fall into our specialty. And then the kind of rare things like spleen diseases, so we do a lot of laparoscopic splenectomies, small bowel resections. In the United States, colorectal surgery is sort of its own specialty. So beyond the colon and rectum is taken care of by a different specialty, and hepatobiliary is a separate specialty by and large. So we do gallbladders, but the liver and pancreas fall into a different specialty. I personally love academic surgery, and I think that being a surgeon and being a researcher and being a teacher, which are the three parts of academics, all fit together really nicely. You know, if you're involved in teaching the next generation, you have to be up to date and current on the most recent things. And so as a surgeon who conducts science as part of my career, it keeps you on the cutting edge because you have to know what the cutting edge is. In fact, hopefully, if you're doing science well, you're creating the cutting edge and you're pushing the cutting edge forward. So I think it makes it a natural place to train the next generation. Also, I just think it's nice to contribute to your field. You know, in surgery, you're one patient at a time, and you get to help that patient, which is a tremendous benefit, and that's why we go into surgery, is because we want to help that patient in front of us. When you become a scientist, you get to help thousands of patients. You know, if you improve a technique or create a new field, you get to help thousands of patients that you may not even ever meet. So I think that's the reason why I like being a surgeon and a scientist. There's an immediacy to it. You get to help the person in front of you. You do the little operation, that little kind of craft project that is to fix that and help that patient. But then you get to create generalizable knowledge that can be used to push the field forward. Well, so I'm an associate editor at Annals of Surgery, and I handle all the foregut and bariatrics work, as well as a lot of the quality and health policy work, because that's my area of academic focus, is healthcare outcomes and quality. So I think that it perfectly reflects my interest in both of those things, in the clinical side and the scientific side, and it allows you to kind of be a resource for people who are trying to produce high quality work and understand what it takes to publish in Annals of Surgery, which for now is the highest impact surgery journal. There are a few nipping at our heels, but for now are still the highest impact journal. But I think being able to help people understand what level of evidence you need to publish in that in journal, but also being a kind of a gateway to making sure that the highest quality material and the most well-conducted studies that should change the field come into our journal. Mentors are crucial. You know, mentors open doors. They have technical knowledge they can impart on you. They have networks of people that they can help open you up to and introduce you to. And at this point now, the world is flat. We have an international network. Every country has its own network, but the international networks are even more robust than they used to be because it's easier to travel, because of social media and ways to communicate more effectively across time and space. So I think those are all important things. When you're evaluating a mentor, you should choose someone who can help you with those three things. You know, can they help you technically become a better scientist? Do they have the skills and background in that? And the way I evaluate that is look at what they've done before. You know, are they a productive scientist? Are they someone who's changing the field? And the second thing is are they a really good mentor? Are they good at taking people below them and elevating them? Are they good at transmitting that knowledge to somebody else? Because it's not necessarily the same thing. There are some great scientists who aren't great mentors, and there are very few great mentors who aren't great scientists. So you want to make sure that they have both. And you can gauge that by looking at their track record. See who have they mentored, what have those people done? Are they putting those people out there first? Are they promoting those people? Are they letting those people run with their ideas? Are they nurturing those folks? You know, the people that have entrusted their careers to them before, how have they executed on that? Have they done a good job? I think that's how I evaluate them. I say do like a biopsy of what they've previously done, because past performance predicts future performance. And that's for established mentors. If there's somebody kind of newer that hasn't had an opportunity, you can still look for it, because even a junior faculty may have mentored students when they were a resident or an earlier trainee. So look for that sort of track record, even in someone who's young. But if someone's really young, you give them a benefit of the doubt. If you click well and there's a good chemistry, because that's another important aspect of it. And then the networking thing. You want to choose somebody who has access to the network that you need to be part of. So if you want to train get a clinical training position in a very specialty area, make sure they are in that area and can network you into that area. That's important as well. Excellent question. Well, I'm a minimally invasive surgeon, so obviously I believe in minimally invasive as one future route, and you see more and more surgery moving that direction, whether it's laparoscopy or using the robotic platform for things that are even maybe too technically challenging for everyone to do laparoscopically, like hepatobiliary surgery. It's kind of really challenging to do that. The learning curve is really steep, but you see the robot taking off in those types of areas, like it has for prostate surgery. Most prostates in the U.S., at least anyway, are done robotically now. It hasn't taken off a lot in my specialty because I think the operations can be done laparoscopically very well. So I think you'll see more minimally invasive. You'll see more and more endovascular kind of creeping into both cardiac and vascular surgery. You'll see a lot of percutaneous approaches creeping in, and endoscopic procedures, combined laparoscopic and endoscopic. So you'll see all those fronts advancing. And it's going to be important for young surgeons coming up to decide where they want to be on that spectrum, right? Because you have the big open spectrum all the way out to the minimally invasive spectrum, and people tend to not be able to go all the way, right? So you want to choose where on that spectrum you want to be. Are you doing laparoscopy and endoscopy with a little bit of open, or are you doing a lot of open and a lot of laparoscopy? You have to figure out which way you want to be, because we're going to need people everywhere. We're already worried about, now that we do so many lap choles, does anyone know how to do an open chole when it's really hard? Can people do open common bile duct aspiration? So we'll need people to retain those techniques and kind of apprentice in those as they come through. In vascular surgery, everyone's doing endovascular care, but who's going to do the thoracoabdominal aneurysms and those complex things? Who's going to have to be busy enough? There's going to need to be somebody, or we're going to lose that as a specialty. So as you're coming up, I think you can still choose broadly, but there definitely will be a movement towards minimally invasive.
Great, thank you for your time.
My pleasure.